something like a seizure. You want to call EMS, report to the bus barn, stay with the person who's ill or injured, comfort them, reassure them. It's a good idea to have others removed from the immediate area. You know, we want kids kind of looking the other way, apart from the person.
All right, Mandy, on your choking?
Yeah.
And Lee and I will come up here.
He's demonstrating.
Okay. So as far as choking is concerned, so a couple different things. There's a partial obstruction, complete obstruction. So partial meaning they are still able to move air, they're still able to breathe, they can make a little bit of noise, but they're coughing. If this happens, please encourage them to keep coughing. If you need to give them some slaps on the back. If they are unable to move any air, that would be a complete obstruction. Something's completely blocking that airway. Universal sign of choking. If this happens, what you're gonna do is, we wanna perform abdominal thrusts. And so you're gonna ask, are you choking? Obviously, if they're doing this, that's what is happening. If they can't move air, they're not coughing, you can't hear anything, they start to turn bright red, eyes start to bulge a little bit. You're gonna stand behind that person, and it's gonna be a fist with your thumb. Yes, thank you. Make this real. And so it's gonna be right above the belly button there, and it's gonna be upward thrusts, okay? Idea being that you want that object to be up and out, okay? And so you're gonna keep doing those upward abdominal thrusts until that object comes out, okay? Or they go unconscious, in which case we want you to kind of have a good stance behind them. If you do go behind them, if it's a small child, get on your knee. Bigger kid, kind of get behind them, do those abdominal thrusts. If they do go limp, you want to have a good base behind yourself so you can safely lower them to the ground, okay? We don't want to get you injured in the process or have a head injury, just kind of letting them fall to the ground, okay? At which point, if they do become unresponsive, we would start CPR at that point, okay?
All right, of course, you know, we don't have any kids like are eating on the bus, so that'll never happen, right? Universal precautions, so you have a medical kit on your bus. We tell you to make sure that you assume any type of blood or body fluid is infectious. So even if a kid has a bloody nose, they can put their hands, even the littlest kid can like hold their hands here while you're getting your gloves on. So don't put yourself at risk. Making sure that you use whatever personal protective equipment you have available to you. So in your medical kit, you probably have some like paper towels, you have, you know, gloves. If you don't have that, see Matt will make sure that you have what you need in case there was something, you know, that was like kid gets cut or has a bloody nose or something like that. You want to make sure that you, infectious control wise, we also don't want to have you guys come into work when you're super sick. If you're recovering for a cold, if you're starting as cold, you know, that's okay. But if you have a fever, if you're vomiting, you're not supposed to be here within 24 hours with like fever, vomiting, diarrhea, everything now. Like some people are asking, well, what are the new COVID rules? Well, the new COVID rules basically are the same thing as like, what if you have flu? If you have influenza, you're not supposed to be here until you're feeling better and you're fever free for 24 hours. Same thing with like COVID is now kind of put into that. We have, you know, they know how to manage it. There's not the same death rate and all that. So we're kind of, that is now no longer a category on its own. It's just rolled back in. So if you have a fever, then that's considered over 100.4. Annual flu vaccine, this district's always very good on offering us going over to the middle school or to the high school. You can go ahead and get your flu vaccine there. You get other blood work done if you so choose. And then other vaccines to be updated as, you know, per your doctor based on your own individual circumstance. Tetanus, like the Tdap vaccine, is something that I think a lot of us forget. It's only good for 10 years. And so that's like if you cut your hand, if you go to the emergency room, they're going to give you a tetanus shot to make sure you don't get lockjaw. But that's every 10 years. So if you're at your annual visit with your primary care person, they should be able to kind of let you know if you know, you're due for your tetanus shot. And you can always get that early. It's not harmful to get early. That's why if you go to the ER and you don't remember when, they just give it to you. now that I told you about gloves, Leah's going to show you how to put on gloves is easy, but taking off gloves and not getting yourself full of whatever's on there is a little bit more tricky.
Yeah, that's the tricky part. So whenever you put your gloves on, that's pretty straightforward. You're gonna put them on before you help that student. Like Lisa said, they can pinch their own nose while you're getting your gloves on. And then when you go to remove gloves, you're gonna take one hand, pull it off this way, crumple it up in this hand, use a finger underneath the glove. So you're just avoiding touching what's in here, and then pull it off inside out. And then you can throw this away. Even if you wear gloves, super important that as soon as you can, you wash with soap and water. You know, hand sanitizer, if that's all you've got at the time, use that when you remove gloves. But as soon as you can, get to a sink and use soap and water, because that's it's just what's best. Bloodborne pathogens, like Lisa said, we have to assume any sort of body fluid could be infectious. You want to protect yourself, use gloves, never reuse gloves. Yeah. Oh, I thought you had a question, sorry. Another vaccine is the hepatitis B vaccine. Healthcare workers, anybody exposed to a lot of people, doctors usually recommend having that vaccine series too. It's just a 3-part series and then you're good.
This is just kind of like a once over, essentially what we've talked about, protecting yourself, create that barrier, wear your gloves, wash your hands, assuming anything could be infectious, so.
All right, so what do you do if you are exposed? So kid, has that bloody nose, or you get something splashed in your eye, what do you do? So first of all, you let Matt know, you make sure that you go through human resources, and there's the company nurse. So we're helpful nurses, and we come out here and help you out and do everything, but the workman's comp part of the job goes through something called the company nurse, and that phone number is available usually somewhere in the break room or the front room. But if you have any type of accident on the job, you call them, and they're like the occupational therapy nurse. They tell you exactly what do you do, where do you go, and make sure that's covered. So there is a whole district protocol. You let your own doctor know. They'll step you through everything. If you get, and that's with not just blood and body fluids, that's like any injury that could happen on the job. But you gotta remember, if you get exposed, it doesn't mean you're gonna get infected. Actually, there's a really small chance that you would have any infection, especially if you're healthy, if you have any type of autoimmune things going on, or taking a biologic drug or something like that. It's still a very small chance for you to get infected from an exposure.
So we'll review some common health concerns that we see in the school setting. Of those being head, neck, back injuries, broken bones, severe allergies, asthma, diabetes, and epilepsy, seizure disorders. So if we do see a head, neck, or back injury, same thing that we kind of reviewed earlier, staying calm. They're already going to be a little bit on edge, so just making sure that you remain calm with that person, calling for help, okay? Do not move that person. If you have found them in a specific position, keep them in that position, okay? Especially if you suspect there might be a head or neck injury. Provide safety and privacy. So just like Leah had mentioned a little bit ago, if we are on the bus, we need to turn people the other way. If we need to safely remove them from the bus, whatever that may mean, but providing some safety and privacy for that person. And provide reassurance, okay? And then let them know that help is on the way because you have called help already.
All right, same thing for broken bones. If a kid has something that is not going the right direction, don't move them. You can use a sweatshirt to kind of support their hand or under their leg in order to provide them comfort. And then with the other kids, just making sure that they are sitting down. Anybody that's standing up has risk of like passing out. Middle school kids are like, it happens all the time. They stand up, they get nervous, and then they hold their breath, and then they pass out. Then you got 2 people to deal with. So we want to make sure that, again, you don't move the student, you stabilize, and then you wait for help. when Matt comes back in, we're gonna ask him what currently he wants to do. What do you guys have going on for calling like 911? Obviously, you walkie-talkie, or do you call it straight from your cell phone?
No, we call on the,
You call the dispatch and then they call like to your location. Yeah. So yeah, I want to make sure that didn't change. So you guys are lucky because you do have that dispatch available. If they weren't to answer for some reason, or like you were like on in bus trip taking people down to Springfield, or there was something else, 911 directly from your phone works too. And then we'll just kind of tell them, oh, Lisa said I could do that, and we'll deal with it later. And then the other thing is if they break their arm or if they break their leg or you suspect something, don't give any food or water. Now, we're not eating on the bus, but don't give them water to help, because if they need to go to surgery to have that set, anesthesia is gonna say, well, how long has it been since you ate or drank? And so you could push back them having a surgery to be able to have comfort and set that.
So as I'm sure all of you know, we have many students who have life-threatening allergies, and whether that's to food or something like latex, we want you guys to feel comfortable responding to that. Anaphylaxis just is the term for when that allergic reaction could progress to them not being able to breathe. The most common allergens are to foods, like these are the top 9 food allergens over here. Everybody thinks of peanuts, but we do have more and more students with life-threatening milk allergies, egg allergies, insect stings, something we've got to think about especially in the early fall, medications, and then latex. So our gloves and the first aid items that you guys have would be latex free. Symptoms of anaphylaxis can be immediate or they can be delayed. Things that you're gonna look for are suddenly wheezing, difficulty breathing, coughing, sneezing, a tingling sensation around the face or mouth. You may see swelling of the lips, eyes, tongue, difficulty swallowing. Some people, when they're exposed, start vomiting, itching with or without hives, sweating. The person experiencing it is also going to be anxious, dizziness, or fainting. As far as administering an EpiPen, I'm gonna let Lisa get around with the rest of them, and then that way everybody can practice. So there are EpiPens that look like this, and then there are also AubiQs, which is a different type of
It talks to you.
auto injector. So as far as the EpiPen, which is what most of you will have for the trainer, you pull off the blue cap, and then you hold it in your fist like this. You don't put your hand on the top, because if you have it upside down and inject yourself, you're not gonna be feeling very well, okay? So fist around, and you do not need to remove any clothing. These needles are made to go through clothing. You're gonna swing into the outer thigh, and you hold for, I think they used to say 10 seconds, 5 seconds is okay. 1, 2, 3, 4, 5. When you remove it, this comes out and covers the needle.
Show them how to reset it.
Yeah, so to reset it after you've injected it, just pinch and push this up.
But you have to have the thing on the
The
safety
blue
on.
cap back on. Put the blue cap back on first. Before everybody practices, I want to show you this AubiQ. These are automated, so when it's going to talk you through what to do.
I'll show you this one back here.
So pull red safety guard down and off.
you turning, click exit down and hold in place for 2 seconds. 2, 1. Training complete.
So these are really nice because they talk you through exactly what to do. And this one now says just 2 seconds.
Yes.
So with a small student, a lot of times it helps to kind of sit them on your lap and, you know, make them feel secure when you give that injection. Anything I'm missing?
Yeah, so we'll let you all practice just for a moment. Just remember to reset it. You put the blue part back on the top, then you pinch the orange part and push it in, and it should be reset. If you can't get reset, just raise your hand. One of us will come by you. But I distribute them around like about every 4 people, so just have everyone try on the outside of your thigh. It says trainer on there. They're not live ones.
No needles.
No needles. No waking up with epinephrine jolts.
Yeah, I mean, you could in theory do it other places to the side that gives you more,
Yeah, they got a new one coming out, aerosol.
nasal.
They-
So there's,
It's coming
yeah,
out.
that nasal
It's coming
one.
today.
That nasal one's kind of
Expensive,
fun.
but
It's gonna look a little bit like this. But that's,
Yeah.
it's just got approved, but it won't be out for, like, use for at least 6 months. And we probably, then insurance companies have to start covering it, but this is so much easier. A lot of our rescue meds you'll see are going to a nasal inhaler. And actually, they're absorbed better through the nose.
Yeah, that's great, great advances, we're excited about that.
Well, we hope, they're supposed to make things out at least a year. So, yeah, like when you get an EpiPen, my daughter has a lot of food allergies, and when I get it, I have to look and make sure that the expiration is not, like sometimes they try to give it to you less than a year, and I'm like, no, I can't take that. I'm like, I need something at least a full year out. So that's why they're supposed to be mandated that it's at least a year. Sometimes pills are longer, but.
Yeah. When you look at the EpiPen, like the actual one, you can see the fluid inside, and it should be clear. It should not be cloudy, and it's like kind of by the window where the fluid is, that's where the expiration date is usually at. And something to remember with the EpiPens too, anytime an EpiPen or AuVQ is given, 911 must be called.
Go ahead.
How many students actually carry them?
So we have about 12% of our students have some type of allergy. We do not have, like, our littles start self-hearing, we start pushing it like in around 2nd grade, we start talking about it. And we have some kids, like, so my daughter, we would keep it outside of her backpack. She would get to school, she'd hand it to the teacher, then the teacher would hand it back to her at the end of the day, and then she would go home.
Are most families doing that? Because
No, I think we try to, like, they're afraid that their kids aren't going to be able to handle that. We want to make sure that the doctor can. We start really talking about it in 2nd grade. The other thing is we also need to know that they're responsible enough to not take it out, like on the bus, and share it with other kids. So it depends when it's developmentally appropriate. Middle school is when I push really hard. In high school, they should have it on themselves at all times. So if they come to middle school and they're not self-carrying yet, they're having like a lot of conversations. And then with that conversation goes the responsibility of carrying it, not sharing it, not taking it out and showing anyone, but making sure that your friends know where it's located, just in case you have an emergency. Because they should be carrying that when they go out and about the community as well. But for your sake, if they don't have it, then you have to call 911. And luckily, we have a very quick response time. I think our average response time is about 4 to 5 minutes. So then you would want to make sure that you have the kid like sitting up, because it's really hard when you're breathing, you don't want to lay down, right? And so then you just try to help them and to just make it through until someone gets there. Go ahead.
How do you know when it's an allergic reaction where you need to use the EpiPen?
Yeah, that's a good question. Do you want to take it or you want me to keep going? All right, so allergic reaction, you always can err towards the side of using it. Obviously, if they have their throat swelling, if they're having trouble breathing, if they're starting to vomit,
So we usually look and like outside things, if they have a couple hives starting, but no trouble breathing and nothing else going on, or a little bit of rash like on their face, that's okay to wait and just have 911 come. But if they have anything that seems internal or big, so like vomiting, if they're like their body, they ate something, their body's gonna want to get that out. So that vomit isn't like a little herp, it's like truly getting sick. Or they may, if they're little kids, they might be drooling because they can't swallow. So all of a sudden out of nowhere, they're like, my mouth is feeling tingly and it's drooling. So if they have something available to be able to give them, and then when in doubt, you just call 911 and you get them early for any signs of allergic reaction. Kids, if they get stung by a bee, then they could, on the bus or just before they get on the bus, they get some swelling started. You can always call our, EMS services are great. They will work with the kid. Don't be nervous and don't be like, oh, I'm gonna get to 4 stops and then the parent will be there or whatever. Don't be nervous to make that call. People who have kids who are anaphylaxis, they totally would understand. If you called, out of caution, they'd rather have you call out of caution, and we'd rather have you call out of caution instead of waiting. That's a good question. All right, asthma.
Asthma is another common, very common illness, disease in students. It can cause repeated episodes of wheezing, shortness of breath, chest tightness, coughing. Usually students with asthma have inhalers that they can use. They might take daily medications at home. They definitely should avoid triggers, things like pet dander, pollen, air pollution can all be triggers for asthma. If a person has shortness of breath and they have their inhaler, you can kind of standby assist them to use that. The person should sit down. They shouldn't try to walk anywhere with you to get help. You want to call for help to come to you, so get on with dispatch and say, I have a student who's having some difficulty breathing, because they may not have their inhaler with them. So that way somebody's on their way to help. If they do have their inhaler, then you can assist them to use it.
You still call for 911 for that, or?
If somebody's having trouble breathing, definitely.
I mean, they're gonna use it, it's gonna be pretty immediate, isn't it immediate?
It's immediate-ish, but you don't know what the cause was that caused them to do that, because they really shouldn't be stressing out and having a hard time breathing when they're sitting on your bus. Unless they had just PE, like 8th period right before they got on the bus, and then they realized that they were wheezing. Or if you notice that you see a kid just picking out his inhaler and using it every day on the bus, this is only truly supposed to be for a rescue. So for that case, you want to just kind of bring it to our attention, and we'll see what's going on. Why are you using this every day? But really, if they're using it, it's supposed to be for rescue, and you don't know what that initial trigger was. You can't listen to their lungs with your stethoscope and things like that. So yeah, if they are now, you might get some athletes if you're running the sports bus after you're going to Lamont and they have a soccer game and they're coming back. So if they have asthma and then they feel like they need to use their inhaler afterwards, their coach should be totally aware of what's going on, and then you could just is this normal for this kid? And then they should know if this isn't normal for that kid, and then you and the coach would work together with deciding to call for emergency assistance.
And I really meant if they don't have an inhaler, get somebody on the way if they're, struggling.
Any other asthma-related questions or allergy-related questions before we move on to diabetes? All right. You're the diabetes, please.
So diabetes, we do have a decent amount of diabetic students. And so diabetes being a condition where either the body's making ineffective, little or no insulin whatsoever. So blood sugar levels can be kind of wacky. So with this, these students are going to be balancing their blood sugar throughout the day, multiple times a day, pretty much constantly. These days, there is a lot of technology that we're going to see being used. You may see Dexcom, which is actually a sticker that you very well may see on the arm. That actually connects usually to their cell phone or smartphone, or smartwatch, that actually will continuously monitor their glucose levels, which is pretty cool. And then also you might see a glucometer. So this is kind of like usually what we would see one of our diabetic students carrying with them is their emergency supplies. So a glucometer, an insulin pen possibly, lancets, alcohol swabs. And so you might see these kids carrying this stuff, but then they're also gonna have carb sources that they need, meaning juice box, glucose tabs, just quick carb sources. And these kids will be allowed to access those on the bus, so at all times, because they will need to. There may be times on the way home where they're starting to drop a little bit and they know that they need to take a little snack. Again, that's based on developmental level as well. A lot of times the building nurses will keep an eye on that, especially at the elementary, middle school level, and if they are starting to kind of drop a little bit right before the end of the day, they will contact parents, hold that student, not let them get on the bus. They know those students pretty well, so generally speaking, I would say they wouldn't let those kids get on the bus if they saw something trending. But just so you are aware, they do carry these supplies, and they should be carrying these supplies with them at all times.
So really, they're the only ones that are allowed to eat or drink on bus. And that's only, it's not like just because they can, it should only be in a case of emergency. If they're drinking every day, then you want to be like, hey, and then let one of us know and we'll follow up again why. But we do watch them, so we have an app where it's like on our phone, and so we have all the kids listed in their blood sugars. So like 20 minutes before they're supposed to get on the bus, we are making sure that they are in a good place. And then we want to make sure, like sometimes we've got some of our middle schoolers, I'm like, hey, do you have your emergency like glucose tabs in your pocket? You know, just occasionally spot checking, making sure that they have the emergency stuff that they need in case something were to happen like on the route. You know, you never know, like you could be on your route and there's an accident and you get delayed, and then they're supposed, that's their time to have a snack when they get home. So we like pre-prepare, like making sure that they have, you know, on their self or in their backpack exactly what they would need in case of emergency. And we're meeting and talking with those kids and the parents every year before the start of the school year, and that's one of the things we always go over. You had a question too?
Yeah, just curious as to if we see diabetic symptoms, do we prompt the child for, do you have supplies with you? When's the last time you drank or ate something? Go ahead and do something that, you know, take that now.
Yeah, so that goes right into us having like talking about high and low blood sugars, and then we'll answer that question as we go over that.
Okay.
So you can see hyper and hypoglycemia, hyper being high blood sugar, hypo being low. Some symptoms you might see that accompany hyper, so it's a high level would be super hungry, super thirsty, they're getting weak, they're going to the bathroom frequently, blurred vision, feeling nauseous. Things that we would typically do to follow up with that would be checking their blood sugar. Most of these kids have their Dexcom, and so they can see their level on there. But sometimes we would have them do a finger prick just to double check. Again, that would be in their emergency kit with their supplies that they carry. Drinking water, for sure, we highly encourage them to kind of chug some water. And then following up with the nurse. But.
So like that high blood sugar, you'll see up here, like some of our high blood sugar and our low blood sugar symptoms are the same. Like you could be hungry if you're high, and you could be hungry if you're low. You can also, another one is like blurred vision. That's both for the kids with high blood sugar and low blood sugar. So that's why looking at their, asking them to be like, hey, look at your, look at your meter. Is it running high or low? Because then if they're high, we just have them drink a ton of water. But if they're feeling, now, just because they have diabetes doesn't mean they can't have something else going on. So if they're, like, we're not oftentimes going, well, we're never gonna put them on the bus if they're super high, but like at the high school, you may see kids who are more independent, who are like, oh, I can make it home and then I'll just treat there. But they have their, a lot of times they are being watched by their parents as well, and they'll give themselves some insulin through their own pump. So that's nothing you would make that decision. If they are looking out of it, they're looking like fatigued or whatever, or like dazed, and they're not, and they're slurring their speech,
Could be their diabetes, could be something else. You just call and radio for help and let them come help you out. But you could ask them, you know, hey, if you know they're diabetic, like, what's your blood sugar? And then, so then at least you can also tell the first responder what you think could be going on. If they're low blood sugar, that's when we want to make sure that we, and that's usually like under 80, it could be even lower, but that's when they want to eat and get that carb source in order to kind of replace that. But anytime they are feeling, again, dazed, confused, aren't making sense, like are looking a little bit floppy, that's no matter what, that kid, whether they're diabetic or not, you're going to be calling 911 to assist them. They do have some emergency medication that again is often nasal or an injection that can raise their blood sugar like immediately, but that's only given by like medical professionals if they are unconscious, that we can utilize that. So if they were to struggle at all, you just call for help.
I was just gonna mention too, as far as just keeping in mind the developmental level of the student, because you are gonna see a little bit different as far as your elementary kids versus the high school kids. Point being that the high school kids, they are generally speaking fully independent with their diabetes care, and so we are not monitoring them at the high school as far as their blood sugar levels. They are independent in doing that, so like Lisa was mentioning, they may be a little, I want to say riskier.
A little out of range.
Yeah. They might kind of push the boundaries a little bit, but that being said, I feel like they know themselves pretty well by that point, depending on where they're at in their diabetes journey. So they know themselves, they know how they feel when things get kind of funny. They'll tell somebody when they're not feeling right. So just kind of keeping in mind how old that student is. They could be a newly diagnosed diabetic. They could have been a diabetic since they were a young child and they're senior now.
So yeah, and with those kids with diabetes, they've had those experiences where they're low or they're super high. And so over the course of their life, they don't want that to happen again. They don't like that feeling. They don't want EMS to be called because then that, you know, developmentally, they don't want all that attention brought to them for like a medical thing, most of them. So yeah, that's, you know, we try our hardest, you know, with this group to make sure if they're not in target range, we're not gonna, if we know about it, we're not putting them on the bus. We tell parents they need to come, and administrator will sit with them if you need to go home. Like, they will stay at the school.
Another major disorder in children is epilepsy or seizure disorders. Seizures can look all different ways. So there's a seizure that you think of that you see, you know, maybe on TV or in a movie where someone drops to the ground and they are jerking or shaking. Those are grand mal seizures. There are other types of seizures that might just look like staring, brief twitches. Those you may have heard called absent seizures. Yeah.
Yeah, so you may notice, like, if you have on your list a kid with a seizure disorder, like sometimes when I talk to our teachers, we remind them that you may be the first one to see it. Like, they might just be sitting there and looking absent. Now, you're on your way home from school and you're tired from a day and you're like you have ADHD, you might be looking like that anyway, right? So it's hard to know, but with those kids, if someone like were to tap their shoulder or they would call their name, if they respond, then they're not actively having a seizure. If they don't respond at all, then you can, let us know, and we can make sure we talk to the parent too. If you see like something brief goes in and out, but then they seem fine. But again, adults-wise, we worry about stroke and things like that. Kids don't typically have strokes, but you never know. We have kids that have different medical conditions. We have kids, hopefully, who aren't using illicit substances, but anytime you think something's off, again, you go and you call, dispatch to call 911, and then we'll make sure we talk with the parents and see why. We're always gonna, if you make that call and you call Matt or you call dispatch to do that, we're gonna, help support you, being like, hey, they're driving the bus, they have all these other kids, their first job is safety, and they need to make that decision at the time. And if we need to talk about it, we'll debrief, but
we're gonna support your decision as a driver on the road, because you're the one with that kid.
Most important, I think, is to know who your students are that we know have seizures, but also just what to do in case someone unexpectedly has a seizure. Basic seizure first aid is to stay with that person, note the time, very important to look at the clock, because when paramedics arrive, they're going to want to know how long did this episode last. It's very important. Call dispatch, get someone on the way. We don't restrain people having seizures. We don't put anything in their mouths. You can put something soft under their head to kind of protect their head, move them away from something that might hurt them. If they're not already on the ground, you can lower them gently to the ground. And really just allow the seizure to take its course, watch the time, don't leave the person alone. This is too when you want other people around, other students to stay in their seats, not crowd the person.
And because the seats are so narrow, you may be like, having them turn on their side in their seat, and their seatmate is like moved back to the side, and you just keep them in a safe area and support them. Because it's gonna be kind of hard in some instances, especially with a bigger high schooler, to get them to the middle aisle. So it's whatever you can do to make sure that they stay safe. You don't wanna make, it's really old where they said, oh, put a wallet in their mouth or put something in their mouth to keep them from clenching. If you put anything in their mouth, they're just gonna clench down really hard. That's gonna break, then they're gonna choke, or they're gonna bite your finger or something like that. So don't put anything in their mouths. That's kind of like very old thinking.
Any questions about seizure disorders before we move on?
All right, so for accessing your student health information, Matt, when do you run those medical reports for the routes?
Those will get run here at the end of the week. They usually give them to them on Monday or Tuesday before school starts.
All right, so each individual bus will have the medical information of the students that are on that bus or are supposed to be riding that bus, depending, some kids are intermittent riders, right? But there is a medical alert. So right now the nurses are very busy in updating those and putting all that information in. So it's good it's not till Friday, because a lot of our nurses are kind of working on that and getting as much as they can in so that you have awareness of that. Again, those are confidential. Those are for your information. It's not to be shared with other, even discussion here with other bus drivers, if you have a kid with diabetes, if you have a kid with seizures. But we also have added this year mental health conditions, and that's for the whole district. And we need to be this is the first year we're doing that, and we need to be very, very, one more step confidential as far as that goes. If a student has autism, that will be noted on there. There may be sensory concerns, or it might be that they have some language concerns. Now we have some littles, riding the GELP bus. Those are all students with IEPs, might have autism, might have developmental delay. But you'll notice there are some students that are attending who don't, you're like, wow, would never know they had autism, because autism is a very spectrum where it's mild to significant. We also have ADHD is listed on there, and that's for our teachers and for any of us to know if they're hyperactive, if they're inattentive, as far as their learning goes. And then we have students with other mental health conditions, and really destigmatizing that, where a mental health condition versus a physical condition are all conditions in themselves, unique to that person. We're not putting a lot of details on there as to why. It may say that they have depression or anxiety, but we're not putting anything else further. If they have some other mental health concerns, if there's something that's happening on your bus, bring it to Matt. We'll work through it, see if there's something else that we could share or not share. But again, I can't stress enough, a lot of us live in the community where we work. And so, we want to make sure that information is not to be shared amongst our teachers. If I have a 7th grade teacher and an 8th grade teacher, they shouldn't know what's going on health-wise. Same thing with a bus versus a bus. You have sub-routes, you want to make sure that those medical conditions are available on your sub-route. If you're changing your sub-route all the time, you need to, that's one of your things when you get on the bus that you're checking. You're checking everything works on the bus, and you're checking everything about the kids. We also have some kids with medical services plans. Most of those are on our our individual kids who might have a monitor, or maybe like on that GELP bus, where they have like an evacuation plan as to how to exit that kid. May have kids in wheelchairs or something like that. They have specific evacuation plans that are in there, and Matt goes over that with you individually, or sometimes we have some kids where we have a day where we're practicing that with some of our students. So again, these are just critical health issues. They are released to you as a person who needs to know, just because in case of emergency, but everybody, we expect, that is kept confidential. There's kids at, Leah's building that I might not even know about, or Amanda's that I may not.
Our district medication policy, students of all ages may not carry medications, even over the counter. They are not supposed to have them. You should not see students with medications aside from EpiPens, inhalers, and our diabetic students having their supplies. Don't ever let a parent hand you a bottle of pills and say, oh, can you take this to the nurse for me? No, I can't do that. So if you see a student, if they have medications on the bus, say on the way to school, get that from them, bring it in with them to, the dean or the principal, call someone to come out and meet you, just so that somebody can secure that medication on the student and deal with the follow-up there.
Right, or if you find like medications on the floor of your bus, wherever you drop off, wherever you park or whatever, go ahead and bring that into the nurse and to the administrator. We can look up and see what medicine it is, and then we just want to be aware. So we can find trends. Sometimes parents say, oh, the kid didn't eat it, they put it in their pocket, they dropped it on the bus on the way there. Again, our parents should know 100% they don't give you or anyone else, they have to certain medication, all medications have to be checked in, guardian parent to the nurse or to the administrator. If we arrange something off hours, there should be no time that they're handing that off to you.
As far as CPR is concerned, we encourage everybody to take a full CPR class, including AED, first aid. You can take them at local fire departments, Del Norte, Waubonsie, but we are going to cover hands only today.
Alright, so while we're waiting to do this, I think we're going to pass out, as Amanda's showing you this video, it's going to go over hands only CPR, and then we're going to pass out these little, they kind of look, I didn't even realize it looks like you're at the Target right yet. You're not, because we don't have a bunch of mannequins. We're gonna each have one of these. This is new, we're trying this year. This is gonna be in front of you. This is actually where you put your hands for doing CPR, not like we're at the Target range. But this worked really well when I did it with the middle school. We had a bunch of middle schoolers doing it all at once. And so we're gonna watch the video. We're gonna show you how, the AED and the steps it goes through, and then we're all going to just kind of do a couple rounds of CPR together on this paper mannequin. And then at the end, we will give you as well a parting gift of a barrier. We're not gonna be teaching how to give rescue breaths, but we'll give you one of those too, in case you need it at home or whatever, as a thank you for us trying this today. Turn up the volume. I hope it will.
So hands only CPR as opposed to what?
Breathing, rescue breathing. So, oh yeah, that's another word.
So, honestly, hands only is as simple can be. If you see somebody go down, if this is all that you can do, this is great, honestly. Whether it's in the community, when you're on the job, anything, if you can help this person by just doing hands-only CPR, you are going to significantly improve their chances, okay? And it's super simple, quite honestly. So this video is actually made by USA Soccer. So bear with me, but it is a really good video to kind of explain everything, okay?
At US Soccer, keeping our players G! G! You okay? You okay? Coach! G! G! You okay? Can you hear me? Adam, call 911. P. Nate, go get the A and B. G. D. Hello? We're at Olympic Park. My teammate just collapsed. We're performing CPR. Okay. Thank you. Kevin, come here. Put your hands right there, the center of his chest. Push hard and fast, 100 beats per minute.
Call for medical assistance. Remove clothing from patient's chest to expose bare skin. Pull a green pad to roll pads. Peel pads for minor. Apply pads to patient's bare chest, as shown in picture. Press pads firmly to patient's bare skin. Assessing heart rhythm. Do not touch the patient. Stand clear of patient. Shock SI. Press the orange shock button now.
Alright? He just collapsed. We started CPR using AED. He's shot him once. He just started to come back and his name's me. Hey, Roy. You hear me? What's your name?
If someone has a non-contact collapse or a player is struck directly in the chest and immediately collapses, presume that it is a cardiac emergency. Immediately begin hands-only CPR while someone else calls 911 and gets an AED. For each minute that goes by, there is a 10% decrease in the victim's chance of survival. Be calm, act fast, and act as a team. Push hard and fast, 100 times per minute, across the middle of the victim's chest. Do not stop to give breaths. Place the AED pads as shown and directed by the AED device. Then continue performing compressions as directed. The AED will instruct you on how to deliver a shot if REM is advised. It will not direct you to deliver a shot unless REM is needed. If an AED is not available, continue compressions at a rate of 100 times per minute. Alternate with someone else if you become tired, and keep working as a team until paramedics arrive.
At U.S. Soccer, elevating player safety is our mission.
Now that you've been trained in hands-only CPR and the use of an AED, you can play a life-saving role no matter whether you're a coach, referee, player, or parent.
Thank you for taking part. Lend your hands and save a life.
All right, so yeah, this video was made actually at Olympic Park in Schaumburg. And so we have some other videos that the state put out that are not as great. I like this one a little bit better. Again, we're just kind of like introducing you to hands-only CPR today. We encourage for you to talk, do a class. This is not an official like CPR. We are CPR instructors, but this isn't like the official CPR class that we teach. Now that we have 4 in our staff, maybe we're going to be able to do that this year. We've asked for so many years to actually do an official class, so we can talk about that maybe once the year gets started. I know I say that every year, but we're getting this part in, at least now. A good question came up here is if you're not certified, can you do CPR? So as a layperson, or even as, in your role as a bus driver, you are covered by the Good Samaritan Act, which means that you're acting in your best, capacity, whatever you can do in order to help someone. A little bit different than the liability we have. You guys are covered where you're responsible for just doing what you can to be able to save that person. Obviously, the first one is calling 911. And then it depends on the scenario, how you're reacting in order to support that person. But if they were to have, if say you were here, we did add an AED here because, you know, you guys are here in the morning, we have people working out on our buses, we want to make sure that we have what you need available as we do in the other schools. We have an AED present like here in, where's yours located?
It's right there.
Right there.
Oh, right there on the wall. So that's, which one? Oh, I just need to step forward. So yes, right over there. When you open that, it will alarm, but it will not call 911. So anytime that you have a person who collapses, obviously you call 911. That just doesn't go automatically to EMS. When you take it out, the AED will look just like this one. And it really does step you through it. You just need to listen after you open it. All of our AEDs in the district look just like this now when it comes out of there. It might be like in a black case, but they look just like this. You open it up, and you'll hear it in a moment.
Uh-oh.
Oh, it's coming.
Stay calm. Follow these instructions. Make sure emergency services are called now.
You call 911.
Begin by exposing patient's bare chest. Remove or cut clothing if needed.
And in there, there's also an accessory bag where we have
Patient's
scissors.
chest is bare. Remove the white square package from lid of AED.
The package is already on there.
Tear open white package across dotted line and
So-
remove pads.
So as you can hear,
Peel one of the white pads completely from blue plastic.
it totally talks you through.
Peel one of the white pads completely from blue plastic.
So then we take off a pad,
Begin pulling from the
and we're
tab
gonna put it,
corner.
oh thanks, I don't have to put it on myself.
Firmly place the pad without the blue plastic.
And then we
on
take
patient's
off the
bare
other
chest,
one.
Exactly as shown on pads.
And there's pictures on there that shows you how to put it
This pad
on.
can be placed on either of the two locations as shown on pads. Next, peel second white pad from the blue plastic.
So as you can hear, this talks you through the entire scenario. So even if I never like showed you this, and you are like at a, you know, maybe a place of worship, maybe you're at an exercise place, maybe you're at the airport. There's AEDs in so many places now. And they may look a little bit different from what mine is, but you just open it up and either it starts talking to you or press the on button and it steps you through. And then it just kind of gets you started while you're waiting for EMS to come. You will never be able to shock a person who has a heartbeat, so you cannot hurt them. It is only made for someone who's having like an abnormal heartbeat that is kind of like doing like a crazy rhythm. And so it shocks the heart, and then hopefully the heart restarts and then gets into like a normal heartbeat. It also, though, won't shock someone who has like no heartbeat, because there's nothing to kind of restart, but it will direct you then to do CPR. So some people think this is going to shock and change, like put the heart back into right rhythm right away. That doesn't always happen. Something could be going on within their body that just doesn't allow that rhythm to convert over. So then it talks about CPR. We always encourage hands-only CPR because you don't know if there is, you know, if you're doing if you don't have a bag and mask in order to support breathing, if you don't know why that person went into cardiac arrest, it could be something drug related. We don't want you worrying about doing like rescue breaths and you're like getting the timing right. Just circulating the like blood around by doing hands-only CPR helps support that person until EMS comes, because oxygen is still left in your blood. If your heart starts beating, there's oxygen left in your blood. And if you're pushing on the chest and giving hands-only CPR, that's going to the brain and it's going around and supporting them, even if you're not doing the breaths. So, like I said, we're just kind of introducing that today, but now we're going to have you use your little baby mannequins and turn them sideways. And then Leah's going to, and Amanda are going to kind of step you through.
Well, I was just gonna say too, I know there's always a question, how do I know if I need to give CPR? How do I know, like someone's gone down, you've seen them go down, whatever. You're in the community at a store, somebody goes down. How do you know if you need to give it? You're gonna shake that person's shoulder. Are you okay? Are you okay? See if they respond. If they're not responding to you, go ahead and start CPR. If they don't need CPR, they will tell you, because they will jump up and say, what are you doing? So better to err on the side of caution and do it and get it started than wait and have something worse happen. So
Important, if you're gonna give somebody CPR, that they're on a hard surface. I know it's difficult to see, I don't know if you wanna stand up and see. You're gonna use the palm of one hand right at the nipple line of the chest. Put your other hand, go ahead and stand up so you can see. You're gonna stand up to practice anyway. Your other hand on top, fingers interlaced, and you're gonna push down hard and fast, about a third the depth of the chest.
and make sure your elbows are locked.
I'll come back here
so you can
for this
use your
group.
body weight to actually press into the chest. The one thing that I want to note in that video, because that was a child, they were going like this.
Yeah, they
And
weren't
that's
pushing
not
down.
what you would actually be doing. So you can kind of see when Leah does it on the mannequin, it is 2 inches deep. It is deeper than you actually think. So you are actually pushing very hard into that chest, and you very well may hear ribs cracking. Like, that is how hard it is. It's not like in the video where they were kind of like going like that. That's the one thing about the video, is the technique is a little different because it's on a person.
And you still try for the 100?
Yes, so it's gonna be 100 to 120 per minute. And so sometimes they'll say like to the beat of Staying Alive. You can kind of sing that to yourself. With the AED, if you have the AED on, at least the ones that we have here, they will count for you. It'll say push, 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 push. And so you can kind of follow the cadence of that. Some other ones might not do that, but counting out loud helps too.
And you're just gonna continue to do that until someone arrives with an AED if you didn't already have one. The main difference, this hands-only CPR, the only thing that we add in when we certify people in CPR is breaths. And maybe some of you have been certified before giving breaths. So we know that this is still really effective in saving someone who's gone into cardiac arrest, whose heart is stopped, because you're still pumping that blood around your body.
Will that AED work more than once?
Yeah.
Once
Yes.
you try it,
Yep, so once you put the AED on, don't take the pads back off. Even if a person wakes up, don't remove those pads, because they could go back into a cardiac issue. When paramedics arrive, they can remove those pads if they want to. And it will continue assessing the person's heart as you're giving CPR. It will say, you know, pause CPR, analyzing rhythm. And it's reading what their heart is doing.
Yeah, and then it'll say continue compressions, and then it'll tell you to pause. Yep, exactly, yes.
Alright, so I think what we're gonna do is have everyone, if you have a chair behind you, usually the person's on the ground, but we're doing this up here because we don't have a lot of ground space. If your mannequin or papers on your chair, bring it in front of you, or come over here on this side. And we're gonna go just through a scenario kind of like all together and putting our hands down all together, just kind of run through it, kind of like they did on the CPR video that you just watched. All right, so everybody stand up. You can move your chair in front of you if you need to be seeing us. Well, Leah, come back here too, and Amanda can help with that group. All right, good turn. All right, so here's the scenario. Everyone, I came in. You came into the bus barn, you find someone, like a parent was in the lobby, and they collapsed and they were on the ground. So the first thing you're gonna do is, like, the person's on the ground, go ahead and tap onto your person and be like, are you okay, are you okay? Okay, they don't give any response. All right, so we're gonna do this quietly in between so everybody can hear. We're just gonna go through the scenario to get really serious. Are you okay? Are you okay? They don't give any response. We're gonna get Matt in the front office. I'm gonna say, hey, Brandy, call 911. Matt, grab the AED. So guys, everybody together.
Call 911.
Matt, and grab an AED. All right, so then you go back to the person, you reassess them. They're not breathing, they're bluish, and they're limp. So we want to find that spot in the bottom, middle of their sternum, which is on the underarm line. You want to put one arm down, the other arm on top of it, lock your arms, and then we're going to go ahead and give some compression. So we're going to say 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and we're going to stop at 30. But you would just keep going until you get help here or until someone comes with the AED. If someone comes with the AED, whoever's giving those compressions, if they're tired, they can tell that person to take over, right? Because if you're tired and you can't press anymore, you can rotate out. Like I can go for a little bit, Leah can go for a little bit, we could switch, Amanda can go for a little bit. But when you get the AED out, it's gonna take some time for that second person. They're gonna be fumbling a little bit, they're gonna not know what to do, so you just keep giving compressions until they're ready to put the pads on. So again, like I said, today is just kind of like exposing you to this, having you, try, and then just using our little silly mannequin paper, but it's trying to get you to think about what would you do and how would you place your hands, and then what would you do in that situation, even if you're at home. Like I know that's why we've asked you to kind of do this experiment with us today, and let's try. And if you have any questions or anything, go ahead.
Is an AED preferable to CPR?
Actually, they're used in tandem. So an AED, yes, you should get an AED right away. If you are, say, walking at Wheeler Park and your person you're walking with collapses, you do have to leave them and go get help. You want to get 911 and EMS coming right away, especially if they're an adult. Like in the friends and family class or the other classes, we do talk about like with kids, you try to rescue them first for 2 minutes, but adults, if you're with them, you need to go ahead and get EMS going. We have years, like possibly whatever caused our heart attack, it could be years of plaque like that's in there, and we need that EMS service. They have medications, they have different things that can support life, they have IVs and different things like that. Us doing like hands-only CPR on an adult without an AED coming is only just gonna sustain their life for a short amount of time. But that AED, if they're in that bad rhythm that I was talking about, that could shock them back into a good rhythm where their heart starts into a good rhythm. And so an AED is like, if you have that available, if you know where one is, then to have that coming right away is really important.
I think most places in the community have them too. I was actually at TJ Maxx last summer and somebody went down in one of the aisles and there happened to be a handful of nurses there. It was very weird. And we all just kind of gathered around this person. They started chest compressions. I called 911. Somebody else got the AED. They put the AED on. And so I think most places actually have them now. So, which is great. So.
All right, everyone can have a seat again. Are there any other questions that you have? Oh, go ahead. Yep, go ahead. Okay. So he said he was trained for like the sternal, like.
I don't know that that's still.
Yeah.
No.
So, go ahead and answer this.
Put it back up.
So, well, the question was, were you in the service?
I was in with the
So he was saying he was trained where you could do like a cardiac thump really hard in order to be able to put them back into a rhythm. That's not part of the CPR course that we're allowed to teach. I know that is like utilized sometimes in the hospital in like when they have patients going in and out of a rhythm and things like that. But that's not part of our course that we're allowed to. That is and was in the past one of the things, because by hitting onto the chest, sometimes you can put them back into an appropriate rhythm. But I think that as a layperson, that could be considered like battery.
Award or on American Heart Association. They also have like videos that you can see. We can send the video that we showed today to Matt, and you can send that out where you can look at that when you want to, because there's a couple of really good handling CPR videos. So right now, if you just pass the extra paper dummies to the inside, they'll be able to collect those. We welcome you back. Thank you for listening to us. We're going to have a short break right now. Get something else to eat.
So again, welcome back everybody. Ready for another great school year. Before we get too started in anything, we want to do a couple of recognitions. So we have some people hitting their milestone years this year. So we have Simon and Deb hit 20 years this year. Steve Lunasek, Rudy, Jackie, Phil, and Dennis all hit 10 years. And Jim, hope that's a typo. You're not here for 10 years.
That's a typo.
That's right, Jim. Anyway, Jim was 1 year. Or 5 years, sorry. Jim was 5 years this year. That's a typo. We have 2 new drivers. We have David Griffin, who's up here in the front. Dwayne Hazelwood, where is Dwayne? He's running a route. Oh, he's running a route right now. Let's welcome everybody. So like I said, we still need 2 more drivers. We had 2 back out on us during the summer. We've got interviews next week, so hopefully we'll get those last spots filled, and we will be fully staffed, hopefully by the end of the month. The only person was Todd Fink, which I think everybody kind of expected that one, unfortunately. Otherwise, everybody came back. There was no surprise leaves. Perfect attendance last year. Dave Drovey, Jim Millay, John Peterson, Marvin, and Wyman all had perfect attendance. For the time they were here, they had perfect attendance.
Take it with you.
So, last year was a better year than the year before, but we had 8 total accidents, and 7 of them were our fault. So compared to last year, there were 15 accidents, but less of them were our fault. We had a much higher our fault probability this year. Of the 7, 1 person rear-ended somebody. 2 were due to too wide or too tight of trying to do a swing out, and you hit somebody. 1 sideswiped another bus.
Was that swing out like front of the bus or tail swing?
1 of them was a tail swing, and 1 of them was actually the side of the bus because they did not go wide enough and hit a stop sign. 3 either hit a garage door or an object while backing. So please slow down, use your mirrors. We can set up the mirror station like we do every year for you guys to adjust them at the beginning. But as you guys switch buses, you're gonna have to check your mirrors and make sure you can see everything. Let's see if we can hopefully lower that number a bit more. There was a time where we went over a year with no accidents that were our fault. Let's see if we can do that again. All right, GCN trainings this year. There are 11 of them this year. And these are not just me going through a list and saying, let's see how many I can get these guys to do this year. These are all mandated by the state. So there are 11 of them, and it totals out to be about 3 hours and 20 minutes or so. Which you guys have to do on your own, but you are paid for them once you complete them.
Do I do them all at once?
You can do them all in one go. You can sit on your laptop or tablet or whatever at home in front of the TV and do them.
Are they ready to do it?
They are ready to do. As soon as you guys want to get them done,
When do they have to be done by?
they have to be done by October 1st. So, this year, you guys have to do ADA and service animals. ADHD. Yes, the service animal ones comes up because across the country, service animals are becoming more of a thing. But there are places that people are trying to get their pet snakes, birds, their horse, a pig, like there's random animals that people are calling service animals, and they may very well be their emotional support animal, but it's one of those things of how do we accommodate something like a horse on a bus? It's an unreasonable accommodation. ADHD, child abuse, cultural competency, and racial bias, homeless students. As I'm sure a lot of you guys know, there's been a lot of, with the war going on, there's a lot of people coming in and they qualify under that Homeless Act because they're refugees. So it hasn't hit us yet in Geneva, but a lot of the surrounding areas are getting hit with a lot of refugees. Mental illness and disorder awareness, peer counseling, anti-violence and conflict resolution programs, professionalism, sexual harassment, and trauma-informed practices.
So someone just asked, how are you able to go on to look at the GCNs? It's in your email. Adam Law sent it this summer. You can find that one, or tonight, I will send the link to everybody so you can get on. That username is your username. We don't have that in record. The directions will be in there if you need to get it reset to go call HR, not the office, not us. We don't fix it for you. That's HR. But I'll send it in an email tonight. But otherwise, it was sent over the summer by Adam Law.
Thank you.
All right. So some other
Hey,
reminders.
Randy, once we finish this, is there anything else we need to do, or you automatically know that we've done it?
So I never know if you've done it. That's why I ask you for your certificate. So each year I've asked you guys at the end of when you've completed all of them, please don't print off 10 or 11 certificates. Just one has your name, has all of them done, and then I have that so that I can pay you guys out. Because this is paid training. It was every year. We typically pay it out the first weekend of October, because we usually have these all due by October 1st. So, and then there's two sections. When you click on, when you go to this website, there'll be what's required and what is optional. On your own, if you choose to do the optional, we don't pay you for it. That was your choice. You did that. But the required ones are the ones you are supposed to be doing.
Everybody got that? Perfect. Oh, every year we go over these just as a reminder of causes that may lead to immediate dismissal by the Board of Education. So violation of Board of Education policy or violation of any rule or regulation of the Federal Motor Carrier Safety Administration, to include the clearinghouse. So that means if you fail a drug test, that is immediate termination. Violation of any rule or regulation of the Illinois Department of Transportation. So that is while you guys are driving, that's your pre-trip. Anything like that that has to do with the bus. Any violation or any rule or regulation of the Illinois State Board of Education. Gross insubordination or gross misconduct. 3 disciplinary reports within a rolling year. So if everybody remembers, if you get one, say the first day of school, if you get 2 more, by the time we get to we'll say the 21st, it's the first day of school, you have until the 21st of next year that if you get 2 more, that could lead to termination. If you get 3 preventable accidents in a school bus within a rolling year. There's more. There is more. These are all in your agreements as well. So these are not new, they've been in there for a long time, but we like to bring them up, just a reminder for everybody. Falsification of time records or manipulation of time reporting process for compensation purposes. So that is if you are clocking in and out at the wrong time or claiming time that you weren't actually working. For instance, if you're at we'll say one of the private placement schools, you're going long distance and you're pulling over at the gas station on your way back, stopping to grab a drink or something, that you should, if you're gonna do it, first of all, let me know. But if you're gonna do it, you gotta fill out a timesheet and take that time off. You are asking for time that you are not actively working. Improper pre-trip. Improper pre-trip can lead to a suspension of your license. If I report that I fired you guys for that, because we have to send in the paperwork when you guys are no longer a driver for us, the state will suspend your license, your permit for 3 years. You will not be able to be a bus driver again for 3 years. Same if you do an improper post trip. If you guys do not check your bus and a kid is found, that can lead to termination, and it can lead to you not having your permit for 3 years. Use of cellular device while operating a school bus. That includes Bluetooth, such as smartwatches. As far as the state's concerned, you can text and drive with your smartwatch. You aren't supposed to have it on you. Failure to pass alcohol and or drug test. And with the exception of an emergency, a failure to be on the bus while the engine is running and students are on board. An emergency situation is the only exception to that rule. Any questions on those? All right. So as you guys know, because we've talked about it many, many times, we have propane buses now. So if you guys see out there, there's a giant cutout in the grass up by the fuel station. That's where the tank is going to go. We are waiting on the permit from the fire marshal before the tank can be put in. And they will be out next week pouring the pad for that, so that we can keep getting ready for it. Until that happens, what we'll do is we will put out field trips to have people come in and run buses up to either, depending how busy they are that day, there is a company called Trellis in Wasco that they will fuel the bus for you. Or you can take it, they have another location off of Kirk Road in St. Charles. Those are the 2 closest locations. The Menards in Batavia does not have their propane tank out front, so we can't run it there. The next closest place was a U-Haul location in Aurora. So we're gonna have people running there. None of these facilities let you fuel the bus though. You get there, they fuel it for you. So, yes.
Just want to understand that, somebody's going to be assigned to take those propane buses?
No, we're gonna put them out like, it's on your bid sheets. As you guys bid, there were routes that were marked right next to the bus number, it says propane.
Sorry. So my question is, if you have a propane bus, it's your responsibility to get them to those different.
No, we're gonna put them out like field trips. I'll put out a field trip that says I need 4 buses run to be fueled or whatever. Until we get that tank in, we don't want those buses any less than a half a tank of fuel, because we don't want it to, all of a sudden we need to run somewhere and we don't have enough.
So they're not fueling them then? We're doing it?
They will fuel it at that location.
I'm saying that I thought, Rich, there was a company that was gonna come and refuel our buses here.
No, I called around to about 15 different places and none of them will come out and do it. So that nobody's gonna come out to our site and fuel the buses for us. We're gonna have to take them off-site and get them fueled.
What's the range of a propane bus?
They get about the same mileage as a diesel, and it's got the same size tank, so it should last you guys, a full tank should last a couple of weeks. It's not like they'll be fueled every week. But those of you that have propane buses, we need you guys to let us know when you're getting close to half a tank, so that we know we need to get you scheduled to get filled.
So when will the tank be installed, hopefully?
They said at the very latest, November. I know, it's not ideal. They are, what's the word I'm looking for? Optimistic that it will be sooner, but as we've seen all of these projects, I don't trust that. Laura?
Yeah, if you have a propane bus, why can't you arrange your own time when you have time to go and get paid to take care of your bus?
We went back and forth on that, and we thought the field trip was the fairest way to do it, that anybody could do it. Because with having to drive off-site, this would be the one time that you are getting paid to fuel a bus. And I didn't want there to be disputes of how come this person gets to fuel, they're paid to fuel and we don't. So I thought the most fair way was to put it as a field trip, that way everybody has a chance to do it.
When you get the tank,
What's that, sir?
when you get the tank put in, you're gonna be doing your own fuel, I don't want to do the tank for this thing.
Correct. When we get the tank in, you guys will have to fuel the propane on your own. The company is going to come out and show you guys exactly, it's very easy, it's a slip-on quick connect, it's not hard, but they're going to come out and show you guys exactly what to do. We have what's called propane gloves, which are insulated gloves because propane runs at a very cold temperature. In the very unlikely event that propane does come out, it is very unlikely, that's what those gloves are for, so that you don't get frostbite or anything like that. Pamela?
So the propane buses, who's the company, and are they a lot different than the existing buses?
The company is Bluebird. The layout inside, they are the same length. The inside is a bit different. The layout in your guys' driver's area is different. They're here all parked inside the bays if you guys want to go look at them. There are some new features to them, such as there is a switch on your console to the right that controls the pedals that move them back and forth for height. So if you're a shorter person, you can raise the pedals closer to you. Before anybody comes out, because I've already heard people saying it, there are cup holders. It is not in the same place you guys had them before. In that dash to the right, you'll see a black bar that looks like it's out of place. If you push it, the cup holder comes out. The first few people that go and look at them are like, where's the cup holder? I'm like, it's there. It just folds in. No, we did not get the air-conditioned internationals, no. For those of you that were here during the summer, or weren't here during the summer, there was International brought out one of their new gas buses, and it comes standard with air conditioning. We are going out for bid for buses again this year to buy, if I remember correctly, it is 9 more big buses. So they'll have their chance then on if we want to, it kind of gives us time to see if we like the propanes or not, if we want to go a different route. And just, if we go a different route, it'll be gas, because diesel is just not the way to go anymore. We are trying to avoid it, but I can tell you right now, the board members ask me constantly, why haven't we tried it? So 1 or 2 may arrive eventually. Just giving you fair warning, because they're going to keep pestering me on why we haven't tried. Well, there is, St. Charles got some, and West Aurora got a grant, so I'll be able to use them as kind of examples of to why not to get them. St. Charles already has them in Warren. When we have a county-wide directors meeting, the director at St. Charles is already warning the director at West Aurora that you need to get the quick chargers or you won't have enough charge for your PM route. There's a lot of other reasons why not to. But we're not gonna get into that. Let's see, other reminders. Driver's license. Everybody can renew their license within 1 year of your expiration. I advise you do it sooner than later, because there was a few people that got pulled due to their age this past year, but I was at a training for third party, and they are starting randoms again. So there is a chance you will get randomly pulled, regardless of how your age or any tickets, anything. So just giving everybody one, give yourself enough time, because they have now, under the hood is not exempt anymore. You have to know under the hood. You have to do everything. It's no longer an A or B test. It is you do the pre-trip on the entire bus. So, just trying to give everybody fair warning. If you are due within a year, I recommend you do it sooner than later. That way you know if you're getting pulled or not. Let's see. Radio checks. Just a reminder that radio checks every year, if you're at the middle school, when you get here, we need you to call in on the radio at your check-in time so that we know you're here. And if you're here, your radio check is when you're backing out. If we miss your radio check, we will call you on the radio. It's nothing personal. If you called it and we didn't hear it, the office can get busy at times. I'm sure most of you have seen the phones ringing constantly. We can't always answer you immediately because we're on the phone. Kelly tries her very best. What else is there? Just a reminder, fit for duty. If you are in a safety sensitive position, if you are out for an extended period due to medical, you will be asked, regardless of what the medical reason is, to go and get a fit for duty physical from Dreyer, or Advocate, I guess not. It is because you're in a safety sensitive position. So if you're out on medical, you're gonna be asked to get one, just so everybody knows. And that's, if you're out on medical reasons, I believe it's for more than 3 days. You're asked to get a physical. Any questions on that? Anything so far?
There's a question back here.
Yeah.
There's a question?
What's the question, Mike?
Take pay for my wife then? She still has to get the physical?
But unfortunately, I talked to Kathy yesterday. She has to get cleared for her physical before she can bid tomorrow.
I understand that.
Oh.
She did it from her doctor, will not let her, he will not get her a medical release, is what I'm saying.
Oh, so then, yeah, it's the same thing. She can't come back until, once she gets a release from her doctor, she'll have to go to Dreyer.
Right.
And do another one. Route bidding. All of the route bids are gonna be put back out after we're done this afternoon, after the refresher, so they will not be out until after 1 o'clock. Just so everybody's aware for the people that wanna take a look at them. As you can see on the tables, they're labeled. That was not a seating chart as it was announced this morning. That is to make it easier for you guys to find them without having to read every sheet. Kind of gives you an idea of what schools are where. We did keep the special needs that are private placement required with summer school. It worked a lot better this past year. We did not have to twist arms and fight to try and get enough drivers to cover. We actually at one point almost didn't have enough routes for everybody that wanted to do it this year. So that worked out pretty well. Please, however, if you guys are looking at the routes and you take the routes out to look at them, please put them back in the correct folder. There were a couple of folders where people were finding extra routes in them that didn't belong there. But if you're in a route that has an early dismissal, we gave you guys that route ahead of time. It is in the folder with it. So some of the like the St. Peter's buses, some of the sped buses, they will have a high school route in there. That is your early dismissal route. That route does belong in there. Special ed drivers, this is more for new people so that they're aware. But if you're not allowed to change a route during the school year, unless you had no other choice but to take a sped route. Does that make sense? Like if you're the last person and your only choice is special needs, that is the exemption on swapping routes.
That changed last year or no? Yeah, we had one time.
Yeah, that was a special situation and circumstance. And those will come up, and those we can discuss under special circumstances. It was a special circumstance, and we opened it up to everybody due to the special circumstance. But it was created by a special circumstance. That is not the norm. In the bid sheet, in the bid folders, is obviously your route. It's every calendar in there that you would need for that position. So sub drivers, there is every calendar for every school we go into if you choose a sub drive route. Once you pick your bid, you'll get those, you'll get your keys. Make sure you know what time you're supposed to be here for your bid. You only have your 10-minute slot. If we're running early, we might let somebody go in, but you have your 10, everybody gets their 10 minutes.
And that should be the same as what they gave us at the end of last year.
Correct me if I'm wrong, has that changed, Randy, or is that still the same time?
It's
Okay.
the same one, and I sent it out a couple weeks ago. I sent it out last week. I posted it on the board that's behind you. I posted it in the hallway on that board, and I did email it to you last night. It's still the same.
If you have not seen your email, like she said, it's posted on the board by the field trips or in the hallway. So you guys know your time, but it is the same as what you guys were sent out at the end of the year.
When we handed in our
Yep.
Can those times change?
Can they change? Sometimes we run early because people know exactly what they want. They walk in, they grab it, they go. So you can show up early and see, but if somebody's still in there on their 10 minutes, we're not gonna let you in, if that makes sense.
But I was like, last year, I was like, changing like 10 minutes later.
If we did for some reason, we would let you know, but right now it hasn't changed. Yeah, Todd's slot was not filled, so there will be a gap there. So if you're after Todd in seniority, you guys would be able to get in 10 minutes sooner. Let's see. What time do you guys drop off the elementary routes at the schools? 7:50. A couple of them, like Williamsburg, let you in at 7:45. What about the middle school? 8:20. We cannot do any earlier than 8:20 because the teachers are under contract and we cannot expect them to deal with the students until 8:20. So like every year, if you are getting to the middle school before that, or you're sitting there for a bunch of time with the kids, adjust your route and let us know. Run it later. We'll let the families know so that you guys are getting there closer to 8:20. So we're not sitting there for 10 minutes with kids on the bus. As always, directions to the first stop and from the last stop are computer generated. You can guys go whatever direction you feel is the best. Seems like every year people come and ask us, can I go this way instead of this way? Yes, that is computer generated. I did not create it. You can do whatever you want. As for the route itself, we're not making any route changes for the first 2 weeks. We got to give traffic time to adjust to us and to make sure that the stops are going to work or not. After those 2 weeks, then we can start making requests and seeing if we need to do time adjustments or route adjustments. But for the first 2 weeks of school, we will not make any changes. We'll just run it the way it is. Any questions so far? No? Brandy, do you want to go over IMRF real quick?
IMRF?
Yep.
Oh.
Just reminders on IMRF.
So everybody obviously over the summer was not on IMRF, no one was paying towards it. We don't pay during the summer, we only pay during the school year. So starting in August and through May, that's the only time you're paying into IMRF. If you pick a route that is not IMRF qualified, I will use your field trips from last year to try to factor in that you guys qualify for IMRF. So that's why I try to get you guys to do field trips at least a little bit, because a little bit helps every time. Because if you're at 326, you are not IMRF qualified. It's 3.5 hours or more. We are talking with HR right now, trying to see if the 2 3 o'clock field trip routes could be IMRF qualified, because you guys are guaranteed to do the 3 o'clock field trips. So the whole idea with the 600 hours is when you're signing your bid, you are guaranteeing us that you're going to drive more than 600 hours for the school year. So if you're not going to be driving 600 hours for the whole school year, August to May, that's why you're not qualifying for IMRF. Now, if your route changes in the year and your hours increase, that is when we're going to enroll you in the program. After you sign your bids, I will send a spreadsheet to HR. They will know who is qualified for IMRF. Again, a month from now, if your route changes and you have to, you qualify, you will have to fill out the IMRF form again. Because right now they have the forms, they're going to enroll you because you filled out from last year, you will have to re-enroll every year. If you have questions on your IMRF, how much do I have in there? How much more time do I have until I retire? Any questions like that, I cannot answer that for you. I don't work for IMRF. HR cannot answer that for you. They don't work for IMRF. You have to go on the website, log into your name, your information. If you've never done that before, you're going to request for a login and password. That's going to come through the mail. You will have a short time frame when you get that postcard. I, on the other hand, did not do it, so I have to reapply for it. If you let it lapse, you have to redo it again. So all that information is on IMRF. If you need to speak to somebody, you can talk to Scott. He found somebody at the end of last year who answered her phone and could help you with questions. But most of them redirect you to the website, because the website is very informative for you. Forms that I tried looking up for to help you guys. Again, I do try to help you if I can, but most of the information, we don't work for IMRF, we don't know everything. The forms you need are on IMRF, on the website. You just gotta log in yourself and figure out all that information. If you feel like you have a discrepancy and that you should have been qualified, you can ask me, I'll research, I'll talk to HR, we'll go through it, actually it's payroll. We'll go through it and we'll try to figure it out. If you did qualify, I did help somebody last year. Okay, it's not that we don't want you to be part of it, it's just sometimes your route that you pick doesn't qualify for it. Any questions?
I don't have a question, but I'm gonna tell you, when I just went in this week to find out why my information isn't updated, and the phone number in there is no good. It's not even them.
So
they changed their phone number, so now the only way to get a hold of them is do a private message.
It does work, but I finally got through, but then I was on hold forever, and I just hung up.
When
The
you
other
call,
thing is,
I just called Monday.
yesterday. I've been working for 3 weeks to get it. But I also tried, my password didn't work that I redid in April. It didn't take it, it wouldn't work. So then I tried to set up whatever they said, hit that, download the file, brought the file up, completely white blank, that's it. So I can't get hold of anybody, so Scott got me somebody, hopefully that will work. And I couldn't change my password.
Right. I understand the frustration. I get it,
I'm just
but,
learning.
right. It's just, it's not Geneva HR, it's not myself, it's IMRF. So again, we can use Scott's friend per se, But, it's really not his friend, he just got a hold of somebody. But that, you have to go through IMRF. The only thing we can help you do is enroll. That's the most that we can do, is help you enroll in the program. So, any other questions?
A couple more reminders, and then we'll get into some important road closures you guys are gonna wanna know about. Please do not cut through the Mechanics Bay. That is an OSHA thing. It is not a me thing. It is, if you get hurt out there and there's not a designated walk area for you guys, the district gets in a lot of trouble because you're not supposed to be out there. So please don't cut through the shop. Nothing on the dash of your buses as usual. For the holidays, I know you guys like to decorate. You can't have things hanging from the ceiling. You can't put nothing on any of your windows except for the route number, if you still have one of those, and a smiley face for the elementary. Those are the only things allowed on the window. Pre-trip books, as always, you want to have your last one from your last 30 days and a current one. The current ones, if you guys run out, Kelly has them in the office on the filing cabinet next to her, so if you run out or you're on your last page, come and get it from the office. And as always, put them on the stairs on a big bus and on your seat in a little bus. We're not gonna hunt for them, so if you missed them, the fluid check got done, but nobody signed your book because we couldn't find your book. And last but not least, if you're the last one in the garage for the night, shut the bay door, please. Please shut your garage door once you are back and done. Any questions on that? All right, road closures. Starting Monday, when we do our dry runs, you will not be able to turn onto Western Avenue from Fabian. That is going to be closed until September 23rd. It is going to be closed for over a month. We will have to reroute. You can still go east and west down Fabian, but you will not be able to turn north onto Western to get to Western Elementary School. You will have to go around. You will have to either cut through, what is that, Allen, right over there, and go around it. You're gonna have to take Fargo, go through Bentry, one of the other ways to get over there. But you will not be able to go that way. The railroad crossing at...
Wait, you can't turn left on it, but if you go down Allen, you can come out and then turn right, so it's only closed to turn on it?
Yeah, correct.
The whole road's not closed?
No, the whole road is not closed, just at the light.
Okay, good.
So you can go in and out of there, you just gotta go a different way than Fabian.
So if someone gets that route, do they have to announce every day that they're rerouting?
No. I don't need to hear you every single day saying I need to reroute. The railroad crossing at 3rd Street, they are working on widening the railroad track at 3rd Street. We don't generally actively route you guys down that one due to all the commuter traffic. It's a pain in the butt to get through. And they are currently expanding it, so that whole intersection is closed, so there's gonna be more traffic going up 1st Street, because they did 1st Street first.
It's open?
That 1st Street is open, but now 3rd Street's closed. Once they finish 3rd Street, Western Avenue will be closed. The tracks at Western Avenue will be done, and that's probably gonna happen shortly after the Western Fabian entrance opens up.
If they run.
Yeah, if they run on time. So, at some point, Weston's gonna be closed from the other direction, and we're gonna have to reroute again and probably adjust some routes. So, this is gonna be just like last year when they were doing work on the railroad and we had to alternate routes to detour around. So, just be aware of that. If you pick a route that's in the Western Avenue area, be prepared. Let's see. All right. Any questions on anything general so far? Okay. We're going to talk about bus evacuations real quick. Why would we switch to doing bus evacuations now? Not because of the new buses. Anybody got an idea?
Wait till the middle of the year is here.
There you go. Normally, we don't go over bus evacuations until about October because that's safety week. So what happens the other 2 months of school before we start? How many of you guys have actually done a bus evacuation? Okay, about half of you. But because of the way we do them with field trips, not everybody does their own bus evacuation. So you still need to know how. In an emergency is not the time to figure it out. Because whether you show it on the outside or not, you are panicking internally. It's just the truth. No matter who you are, you're panicking internally. So, what are our exits? Yeah, front, back, hatches, and windows. So you have a total of 8 on a big bus and 5 on a little bus, because you only have 1 hatch on a small bus. And only 2 windows.
Well, you know, they say you can kick out the front.
Not anymore.
Not anymore.
On the international buses, you still can because of the way they put them in. It's still the same old design, but the new Bluebirds, you would not be able to. On the Chevys, you're not going to be able to. You can try, but you're just going to hurt yourself.
I'll still be stuck inside, so I guess I can't.
All right, so we know our exits. If you go out the back door, how do the kids go out the back door? Sit and slide out, and then you need 2 assistants to help you get the kids out the back door. Okay, just making sure you guys aren't telling kids to just jump out the back door willy-nilly. In the Bluebirds, you will have to sit. Surely saw the back door is a little shorter than what you're used to in the internationals. What are the reasons we would evacuate a bus? Fire, that's one. Bad positioning.
Weather.
Breakdown. Weather. Stuck on the railroad tracks. Yep, hazmat spill. And I think I heard it, but unlikely is water. Very unlikely, but it is possible. All right, so if you're in an emergency situation, how do you know which door to use? Depends where the emergency is at. If the emergency is at the back of the bus, you're going to go out the front. If it's at the front of the bus, you want everybody to go out the back. And you want to get them out as quickly but as organized as possible. It takes 2 minutes for that bus to fill with smoke if it's on fire. 2 minutes. So whether you do an evacuation with your kids or not, make sure your kids on the bus know the process. Make sure you know which kids, your older kids, you can trust to help you get the kids off the back of the bus. And make sure you know which kids you can trust or you can show how to use the radio if for some reason you're in an accident and you are incapacitated. Because if none of them know how to use the radio, then it's just a bus full of kids sitting there not doing anything. And we can't get you help if we don't know. So what's the first thing we do if we get into an accident or emergency situation? Call into dispatch. Let us know.
Make sure everybody's okay first.
Yes, you want to check your students, make sure everybody's okay, because that's going to be the first question we ask you. Is everybody all right? But if you are in a situation where you got to evacuate, tell us you're evacuating the bus so that we know, because we're probably going to try and respond to you and you don't have time for that. You are dealing with getting all of those kids out of the bus. So we need to know so that we can start heading your direction and calling 911 as soon as possible. Any other questions on anything? Doug?
Yeah, an emergency, you can know where we are based on GPS, or we could be.
We can. If you tell us there's an emergency, I can pull up your cameras remotely and access it.
So, because you said you're gonna start doing this now, you're going to, how are you gonna do this? You gonna do it as a field trip, or you gonna have each person do it on the bus?
No, we're still gonna do it as field trips. The hard problem with switching away from that is every kid, whether they ride the bus or not, has to do it. So we're not like Cayman, where we're out in the middle of nowhere, where every kid rides the bus anyways. We've got a lot of people that go in by car, they walk, whatever. So you can't just say, we're gonna stop at the school in the morning. I would love to do it that way. I think it would be the best way, because everybody would do it.
It makes sense. You have your own kids.
But it just unfortunately isn't feasible, or we haven't come up with a way to yet. I'm still trying to figure out a good way for us to do that. But what I would like to do is, we're talking about it now, making sure everybody knows how to do it. In October, when we normally do it, I would like everybody to get on the bus and actually do an evacuation out the back door. Because we can talk about it all day long, but until you guys actually see it and go through it,
I feel like we did that one time. Was that the special needs?
that had to have been, say, that had to have been a long time
It was
ago.
a special needs.
Oh, yes. Sped routes, yes, usually you guys do your own because you guys are going to specific schools and you guys do it on the day that they request.
Yeah, I want to ask something.
Yeah,
When you do the bus evacuation scheduling, could you have a little bus scheduled for the students that require that? Because I do them, and these poor kids get on the bus, they're freaking out because it's not their normal environment. Some of them have, things to help them hear or whatever. We can't do the alarms, we can't do the things that you normally do for the big kids. I think it would help them to understand how to get out of a smaller bus that they ride every day.
we'll talk to the schools about it because normally they just enter in their bus evacuations and we do it per their request. So it's their choice that they're putting them on the big bus. But we can explain that to them because that does make it difficult.
It does. That would make a big difference.
Okay.
Especially if they're riding, especially a bus for a field trip, they wouldn't need to know how to evacuate on a big bus.
Yeah. Well, and they don't always take a small bus though, but I get your point. It would be easier when doing the evacuations. Any other questions? Shirley?
The tail swing on the Bluebirds, is it the same as the Internationals or is it different?
It's a little bit smaller because the Bluebirds have a tighter turning radius. So they can take some of those sharp corners a little bit easier than the Internationals can.
Are they taller, the Bluebirds? They look like.
They're the same height. Believe it or not, they are the exact same height. It's just inside, when you get to that back door, it gets a little shorter. But they're the same height inside now.
Outside too?
Yep. Since we're talking about the Bluebirds, if you end up having to do a fluid check on the weekend on your own bus, those have a lock on them so that the hood will not come down on you. On the passenger side of the bus, there's a lock, so when you pop the hood, there's a little yellow handle so you have to lower it from that side. You cannot lower the hood from the driver's side, because you have to pull that as you lower it. So just in case one of you end up doing it on your own.
So when you raise the lid, the lock is automatic?
It's automatic. Once it goes up enough, it locks into place and you can't lower it until it's just a little like paddle triangle. You just move it to the side and it lowers down. It's nothing sophisticated. It just keeps it.
When you do the pre-trip, those Bluebirds, they don't have that computer on them, do they? Where you have to go and tap everything?
The Zonar? No, we don't have Zonar. We didn't add that. They just got the same stuff we've already got. We put the cameras in them, and the radios, though the cameras are disconnected at the moment. They got installed incorrectly and they're pulling too much power and killed all the buses. So they're supposed to be out this week to fix that. But in the event it's not, you go to take your bus on Monday and you notice the camera light's not working and you're in a Bluebird, that's why. It's been intentionally disconnected. We're aware. I will tell you, for the people that have them that run out of the middle school, the propanes heat up in about 10 minutes. It is significantly quicker than the diesels.
The inside of the bus, or you're talking about the engine?
Both.
Oh.
Do they start up better in cold?
Yep.
than diesels?
Propane actually works better in the cold. The only time that they get to an issue is if it's negative 44 degrees outside, and at that point, we're not having school.
I don't know if we assigned it where buses are parked yet, but does that mean that Franklin would be at middle school?
So I started to do that. I tried that. So hear me out. We did that. And we have all the schools paired very nicely, like 2, 3, and 4 are Fabian, 18, 19, 20, 21, we're Mill Creek. You know, we tried to keep the numbers near each other. Well, guess what happened when I tried to put them all at the middle school? It was chaos on our computer end because we used to be able to go in there and look and we knew close to what number and that's what elementary it was. And no, you had bus 8 was over there, bus 45, bus 13, it was chaos. So we ended up not going that route. I will say a significant amount of them are at the middle school, but not all of them.
Are they keyed the same?
They are different from the internationals, but all the keys for them work for, like, one key will start any of the Bluebirds, but it's not the same key as the internationals.
And the door key is different too?
The door key is the same as all of our other door keys. They were able to key them all the same.
So the door key is common across both
Yep,
buses?
the door key is common across everything, but they could not key them the same as the internationals. It's just altogether a different key style. It's a lot shorter. It's more like your car key. When you go to start them, there is no hold the ignition and wait for it to start. You click the key over and you let it go. And on the dash, you'll see it says start in progress. And it does a bunch of checks to make sure everything's good with the propane system. It starts on its own. You don't hold the key and it does its own thing. So I'm sure that will take some getting used to for people sitting there holding it, wondering why it's not starting.
So don't hold it.
No, don't hold it. You just click it over and it'll do it on its own.
And then the safety,
Child check is the exact same. No difference there. The only other difference, and not that I think we would ever have a problem with it, it's just a feature that came with them, is if you don't put your seatbelt on, it beeps like the little buses do. But I don't think we've ever had an issue with nobody wearing their seatbelt, so I don't see that being an annoyance. And if it is an annoyance, then you should put your seatbelt on.
So some driver will get 2 different keys then?
Yes, I think we still gotta make copies of the other one though, but yes, you would end up with 2 keys.
Matt, do we have to have seating charts?
For the elementary, they still wanna do seating charts, but
Who's that?
the principals want to because they say it cuts down on the behavior issues drastically. So what we do is we go into the computer and it just click auto assign by stop and it throws the kids on the bus. And we give it to the school and they change it if they want to. You guys have full right to change it as you want to.
Are they doing the family thing because of the COVID?
No. There's people that request that, but everybody's told they have to go through the school if they want to change it, other than the driver changing it.
So if we want to do something like sort by grade, like kindergartners up front?
You can.
It worked a lot better for me in that grade.
You just gotta give us an updated sheet. You gotta write on the sheet you got and let us know what you changed it to, so that we can let the school know. Jackie?
As a subject, anybody changes their stops, it has to be known in the sheets.
Please don't make sweetheart stops or anything. Does everybody know what a sweetheart stop is?
Front door service.
Front door service. It's when you've got a bus stop, but the kids live right around the corner, so you just go and pick them up at their house anyways. So when the sub bus driver gets in the bus, they go to the corner, no one's there, and they take off, and the kids are yelling, running after the bus. It creates a dangerous situation for the kids, and it's very frustrating for the drivers because parents are yelling at them about how come you didn't stop when subs have no idea you're doing this. If you're going to change your bus stops, you have to get it approved through the office first. If a parent asks you to change their stop, they gotta go through the office. Call or email, they gotta talk to us. We won't just make changes. You guys are welcome to make recommendations on bus stop changes. You guys see it, we don't know what trees aren't trimmed back. And we're doing the best we can with the knowledge we've got. So if you guys think one isn't great, we can take a look at it. But don't just do it. We gotta know first. Any other questions? Got one last thing for him?
I'll look at a couple things. Do not tell the parents to call the office. Because what we're gonna tell them is email us. So if you're telling them to call us, now we're doing a double step, and there's enough phone calls that come in the office that we don't need another parent who wants a special stop or anything changes, because you don't know that we've already spoken to them in the last few weeks. So once everything went live, Kelly and I we're all trying to get through these emails, and these parents are asking for different stops, move my stop here or there. So we've already spoken to them, so by you telling them to call us, that's just causing more. I printed off cards last year for the special needs buses. I'll print them off, and you guys can all have at least a couple on your buses, so you guys have them. Give them that card, it's got the email address on there, they can email their request. And then that gives us time to actually research what they're talking about, find out if it actually is a good change or whether there's not. So email transportation requests, not calling the office. Just saying. We don't want the parents getting mad because, well, the driver told me to. Just tell them to email the office. Another thing is, we had 12 schools start this week. Either they're still in session or they started this week. We had most of the routes covered. A lot of you guys helped us out. You're just driving them for us. We still have 3 more routes that need to be covered. We've got Krutchke PM on Friday. We've got the C program, which are the 12 plus kids who go to Waubonsie College. I need someone to help me with that one. And then also Innovations, which is out in Streamwood on Friday. So if you're available, even if you do half a day. So somebody came up to me and said I could do AMs on Thursday and Friday. I gave it to them, and those kids are getting to school. I got one who's gonna do the PM. They're gonna come home from school. But I need someone to pick them up from Krutchke on Friday, because I'm not gonna leave them at Krutchke. I know I have my license now, but I'm not gonna go pick them up. But I don't have to. I mean, you're all walking in the office saying that you need money. Well, here you go. Let's start out with this week. So I have 3 more routes I need you guys to help cover. Also, field trips are posted for next week. Sign up for those. We need the drivers to go there. With that being said, when you bid tomorrow, if you bid on a route that is already started, you will run your route after you sign your bid. So you'll do your dry run tomorrow, and then you will start driving those students on Friday. So if you are thinking you're gonna start next week, look at your choices again. So you will start tomorrow on Friday if you pick a route on Thursday. So, and we've told those parents the same thing. We told them they're subs, but your driver could be starting on Friday. So dry run tomorrow night if you guys sign your bid tomorrow for a route that's already started. If you have a cheat sheet in front of you that has names on it, clearly that's wrong because no one has a bid yet. You can toss that out. There's a recycle bin over there, there's a shredder in the office, you can throw it in that bin. I did print off 75 copies, so you can walk out after your 2-hour refresher, or if you're not staying because you went yesterday, you can pick it up at the front window. But again, it's what it is right now, doesn't mean it's gonna change in a few minutes. I did email one last night too, okay? Tomorrow when they sign bids, I will try to send one out every half hour, maybe every hour, as fast as I can, okay? So, any questions? Okay, I'm done.
And you guys are free to go. Those of you that have the refresher class, it starts promptly at 11 o'clock, so if you are not